I am going to pass it on now to Jay Preet.
Good afternoon, everyone. So I'm just going to go over some changes that are kind of evolved in dentistry. So currently we are kind of shifting towards prevention and therapy-based profession rather than treatment-based profession. So we are a little bit more focused towards prevention. And then removal of teeth used to be really common back in the days. So now we are trying to just preserve natural teeth. So trying to save teeth whenever we can is our main priority. And then if we do need to remove teeth, there are some prosthetic devices that are available, such as implants that have become much more popular nowadays. And then as we all know, technologies are advancing and evolving. So we are improving in our oral dental hygiene products, and we do have digital scanners as well for great accuracy and efficiency, and enhanced cancer prevention and cancer detection products. So now I'll just pass it over. Thank you.
Hi everyone, my name is Alejandro, and I'm just going to talk about some oral and systemic health conditions. A lot of times, myself included, people don't consider the effect of systemic health on our oral health. Things like our diet can affect, whether we're more likely to develop cavities. Systemic conditions such as diabetes and Sjogren's system can reduce our saliva, which also can cause cavities. Osteoporosis affects the bone, and we have lots of bone in our mouth, and we don't want that to be damaged. So, and things like autoimmune diseases can weaken our healing factors. So we just need to be mindful of how all of these can play in and affect our oral health, and try and utilize preventative care as best as we can.
All right, so we're going to talk about importance of regular dental care. Basically, हमें regular dental care क्यों चाहिए? Two parts में divide करते हैं. First, medical and dental. Medical के लिए us as students or dental professionals, हम systemic issues जैसे Alejandro ने बताए सारे we detect because हम medical history लेते हैं पहले. And then accurate diagnosis is important as well. There have been instances जब हम blood pressure लेते हैं और किसी को पता भी नहीं होता उनका blood pressure इतना high है. So then we write a referral and वो physician के पास जाते हैं, and then they get to know, oh, they are hypertensive. So similarly, we deal with the teeth as well. So caries is like important to like notice. Like cavities जब शुरू होती हैं, they don't cause pain, और हमें लगता है ओ हमारे दांतों में दर्द नहीं है, so it's all good. जबकि ऐसा नहीं है. वो एक पॉइंट तक इतनी प्रोग्रेस हो जाती हैं कि हमें रूट कैनाल कराना पड़ता है. Now, why हमें रेगुलर डेंटल केयर इसलिए चाहिए ताकि वो अगर जब शुरू हो जाए तो हम उसे प्रिवेंट कर सकें और जल्दी ट्रीट कर सकें. That's what it means, early detection and intervention of cavities and gum disease. So regular dental care means 3 months, 4 months, or 6 months is important to clean your teeth so that you don't get cavities, and preservation is better than curing. Like prevention is better than cure, because I don't know, abhi kisi ko pata hoga, RCTs are like thousands of dollars, whereas just cavities are like 200, 300. So preventing it, treating it before is less costly than to get to a point jahan cavities itni zyada ho jaye and then it's also costly. So that's also going to save you. So prevention is better than cure. Next, all right, I'm going to change this now. Okay. All right.
Hello everyone. So as Angel mentioned, keeping and maintaining healthy gums and teeth, which is basically soft and hard tissue, it happens during regular brushes. We recommend having 2 times a day brushing, early in the morning, late in the night, and also feel free. You can brush your teeth anytime in the day, especially after having a food. Also, as she mentioned, with having a regular hygiene and dental cleaning, we can prevent other issues that will come, like, diseases and caries and no one of us want to have dentures or cavities, root canal treatment. That's gonna cost us a lot, as well as, having regular dental cleaning will help us just avoid that issue. And also detecting issues early. So, regular dental hygiene appointments can detect early caries, so you don't have to wait until you have your cleaning until we detect a bigger caries, or we're gonna say that there is no hope in that teeth, we need just an extraction. So early detection of caries and any other problems in mouth, that's gonna be beneficial to us. And also, with keeping an eye of our oral care, we can detect sometimes if there is a pain, or if there is any issues with if there is a denture sitting, or we can detect a caries if the tooth is colored. So keeping an eye, it will help a lot, and also reduce the extensive need for other treatments. All right, now I'm going to pass it to.
Hello, me again. So I am going to go over some products here. So most of these are more centered towards dentures or those with dry mouth. So there's some paste there. The Biotene is a dry mouth gel. You can rub it on your gums and your tissue. The Polydent and the denture brush is more centered, obviously, if you have a partial denture or a complete denture. And then the dry mouth paste, that's the one with all the rainbow colors, that is actually going on your teeth. So what you would do is you would brush your teeth, you would rub it on the teeth, and then you want to leave it for a minimum of 3 minutes and not rinsing it off. And for the next one, this is more centered for everyone else. So I had put a water flosser there. So water flossers are great alternatives, especially if you have limited dexterity, meaning like you don't have great movement with your hands and that kind of thing. It can really help you. There's powered toothbrushes. Powered toothbrushes are amazing to get in the areas that we can't reach. Manual toothbrushes, we don't know how hard we're pressing. Powered toothbrushes give us that indication of you're pressing too hard, or this is your 30-second mark, this is your 60-second mark, that kind of thing. There's also some really cheap ones on Amazon if that is something that interests you. I also included a brush there, that little orange one. Again, if you have limited dexterity, you can use that. It's a bigger handle. It makes it a little bit easier if you have things like rheumatoid arthritis or osteoarthritis. And then the gel in the bottom there is actually just a dry mouth toothpaste. So same kind of thing. As we age, our collagen in our mouth starts to deplete, so we want to be taking care of those areas with dry, less saliva with a different kind of paste. So yeah, thank you very much. I'll pass it on again.
ओके हेलो सत श्री अकाल आदाब सारिਆਂ ਨੂੰ सो ਹੁਣ ਆਪਾਂ ਡਿਸਕਸ ਕਰਾਂਗੇ ਜਿਹੜੇ ਸੀਨੀਅਰ ਡੈਂਟਲ ਪਲਾਨ ਹੈਗੇ ਆ ਵੀ ਆਪਣੀ ਡੈਂਟਲ ਟ੍ਰੀਟਮੈਂਟਸ ਕਿਵੇਂ ਕਵਰ ਕਰਦੇ ਆ ਸੋ ਪਹਿਲਾ ਪਲਾਨ ਹੈਗਾ ਯੂਨੀਵਰਸਿਟੀ ਆਫ ਟੋਰਾਂਟੋ ਸੋ ਇਹਦੇ ਵਿੱਚ ਕੀ ਕਵਰੇਜ ਹੁੰਦੀ ਆ ਇਹਦੇ ਵਿੱਚ ਹੈਲਥ ਤੇ ਡੈਂਟਲ ਇੰਸ਼ੋਰੈਂਸ ਪਲਾਨਸ ਕਵਰਡ ਹੁੰਦੇ ਆ ਜਿਹੜੇ 65 ਪਲੱਸ ਹੁੰਦੇ ਆ ਸੀਨੀਅਰਸ ਤੇ ਕਵਰੇਜ ਇਹ ਉਹ ਹਿਪ ਜਿਹੜੇ ਆਪਣੇ ਹੈਲਥ ਕਾਰਡ ਹੁੰਦੇ ਆ ਉਹਨਾਂ ਵਿੱਚ ਕਵਰਡ ਨਹੀਂ ਹੁੰਦੇ ਹੈਗੇ ਕੌਣ ਐਲੀਜੀਬਲ ਹੁੰਦੇ ਆ ਇਹਨਾਂ ਲਈ ਜਾਂ ਤਾਂ 65 ਇਅਰਸ ਤੋਂ ਉੱਪਰ ਹੋਣੀ ਚਾਹੀਦੀ ਹੈ ਤੁਹਾਡੀ ਏਜ ਜਾਂ ਫਿਰ ਤੁਸੀਂ ਰਿਟਾਇਰਡ ਹੋਣੇ ਚਾਹੀਦੇ ਹੋ ਐਜ਼ ਅ ਸਟਾਫ ਔਰ ਫੈਕਲਟੀ ਮੈਂਬਰ ਯੂਨੀਵਰਸਿਟੀ ਆਫ ਟੋਰਾਂਟੋ ਤੋਂ ਐਂਡ ਤੁਸੀਂ ਰੈਜ਼ੀਡੈਂਟ ਪਰਮਾਨੈਂਟ ਰੈਜ਼ੀਡੈਂਟ ਹੋਣੇ ਚਾਹੀਦੇ ਹੋ ਓਨਟਾਰੀਓ ਦੇ ਓਕੇ ਸੋ ਇਹ ਕੀ ਕਵਰ ਕਰਦਾ ਆਪਾਂ ਨੂੰ ਸੋ ਪਹਿਲੇ ਹੈਲਥ ਬੈਨੀਫਿਟਸ ਹੁੰਦੇ ਆ ਪ੍ਰਿਸਕ੍ਰਿਪਸ਼ਨ ਜਿਹੜੀਆਂ ਡਰੱਗਸ ਦੀਆਂ ਹੁੰਦੀਆਂ ਵਿਜ਼ਨ ਦੀਆਂ ਜਾਂ ਫਿਰ ਕੋਈ ਵੀ ਪੈਰਾਮੈਡੀਕਲ ਸਰਵਿਸਿਜ਼ ਹੁੰਦੇ ਆ ਜਿਵੇਂ ਆਪਾਂ ਫਿਜ਼ੀਓਥੈਰੇਪਿਸਟ ਕੋਲ ਜਾਂਦੇ ਆ ਉਹ ਸਾਰੇ ਇਹਦੇ ਵਿੱਚ ਕਵਰਡ ਹੁੰਦੇ ਆ ਤੇ ਡੈਂਟਲ ਕੇਅਰ ਦੇ ਵਿੱਚ ਕੀ ਕਵਰ ਆਉਂਦਾ ਇਹਦੇ ਵਿੱਚ ਰੂਟੀਨ ਜਿਹੜੀਆਂ ਆਪਾਂ ਡੈਂਟਲ ਕਲੀਨਿੰਗਸ ਕਰਾਉਂਦੇ ਆ ਸਫਾਈਆਂ ਕਰਾਉਂਦੇ ਆ ਐਗਜ਼ਾਮਸ ਕਰਾਉਂਦੇ ਆ ਆਪਣੇ ਡਾਕਟਰਸ ਕੋਲੋਂ ਫਿਲਿੰਗਸ ਹੁੰਦੀਆਂ ਜਾਂ ਆਪਾਂ ਟੁੱਥ ਨੂੰ ਐਕਸਟਰੈਕਟ ਕਰਨਾ ਆ ਕੱਢਣਾ ਆ ਉਹ ਸਾਰੇ ਇਹਦੇ ਵਿੱਚ ਕਵਰੇਜ ਹੁੰਦੀ ਹੈ ਸੋ ਉਹਦਾ ਬੇਸ ਜਿਹੜਾ ਬੇਸਿਕ ਪਲਾਨ ਹੈਗਾ ਆ ਉਹ ਹੈਗਾ $400 ਪਰ ਈਅਰ ਜਿਹਦੇ ਵਿੱਚ 70% ਬੇਸਿਕ ਸਰਵਿਸਿਜ਼ ਕਵਰ ਹੁੰਦੀਆਂ ਦੂਸਰਾ ਇਹਦਾ ਪਲਾਨ ਹੈਗਾ $500 ਪਰ ਈਅਰ, ਜਿਹਦੇ ਵਿੱਚ ਅਗੇਨ 70% ਸਰਵਿਸਿਜ਼ ਕਵਰਡ ਹੁੰਦੀਆਂ ਬੇਸਿਕ, ਜੋ ਮੈਂ ਤੁਹਾਨੂੰ ਪਹਿਲਾਂ ਦੱਸਿਆ, ਕਲੀਨਿੰਗਸ, ਐਗਜ਼ਾਮੀਨੇਸ਼ਨਸ ਹੋ ਗਏ, ਫਿਲਿੰਗਸ ਹੋ ਗਈਆਂ, ਜਾਂ ਆਪਾਂ ਦੰਦ ਕਢਵਾਉਣਾ ਆ, ਉਹ ਸਾਰੇ ਇਹਦੇ ਵਿੱਚ ਕਵਰਡ ਹੋਣਗੇ। ਇੱਕ ਇਹਦਾ ਸਿਲਵਰ ਪਲਾਨ ਹੁੰਦਾ ਆ, ਜਿਹਦੇ ਵਿੱਚ $600 to $900 ਕਵਰਡ ਹੁੰਦੇ ਆ, ਐਂਡ ਉਹਦੇ ਵਿੱਚ 80% ਕਵਰੇਜ ਹੁੰਦੀ ਆ ਤੁਹਾਡੀ। ਇੱਕ ਲਾਸਟ ਹੁੰਦਾ ਇਹਦਾ 골ਡ ਪਲਾਨ, ਜਿਹਦੇ ਵਿੱਚ $170 ਤੋਂ $1,500 ਕਵਰਡ ਹੁੰਦੇ ਆ, ਤੇ 80% ਕਵਰੇਜ ਬੇਸਿਕ ਹੁੰਦੀ ਹੈ, ਪਲੱਸ ਉਹਦੇ ਵਿੱਚ 60% ਕਵਰੇਜ ਆ ਜਿਹੜੀ ਉਹ ਮੇਜਰ ਹੁੰਦੀ ਹੈ। ਸੋ ਇਹਦੇ ਵਿੱਚ ਰੀਕਾਲ ਵਿਜ਼ਿਟਸ, ਲਾਈਕ ਆਪਾਂ ਜਿਵੇਂ ਡੈਂਟਿਸਟ ਕੋਲ ਬਾਰ-ਬਾਰ ਜਾਂਦੇ ਹਾਂ 6 ਮੰਥਸ ਬਾਅਦ, 9 ਮੰਥਸ ਬਾਅਦ, ਜਿਹੜੇ ਇਹਦੇ ਰੀਕਾਲ ਵਿਜ਼ਿਟਸ ਹੈਗੇ ਆ ਉਹ ਵੇਰੀ ਕਰਦੇ ਆ ਪਲਾਨ ਟੂ ਪਲਾਨ, ਕਿਹੜਾ ਪਲਾਨ ਤੁਸੀਂ ਕਿੰਨੇ ਦਾ ਲਿਆ ਆ। ਸੋ ਟਰੈਵਲ ਇੰਸ਼ੋਰੈਂਸ ਆਊਟ ਆਫ ਕੰਟਰੀ, ਜਿਹੜੀਆਂ ਐਮਰਜੈਂਸੀ ਆਪਾਂ ਟਰੈਵਲ ਇੰਸ਼ੋਰੈਂਸਿਸ ਹੁੰਦੀ ਆ, ਲਾਈਕ ਆਪਾਂ ਆਪਣੀ ਹੋਮ ਕੰਟਰੀ ਜਾ ਰਹੇ ਹਾਂ ਜਾਂ ਕਿਤੇ ਹੋਰ ਕੰਟਰੀ 'ਚ ਜਾ ਰਹੇ ਹਾਂ, ਤਾਂ ਐਮਰਜੈਂਸੀ ਟਰੈਵਲ ਇੰਸ਼ੋਰੈਂਸ ਵੀ ਕਵਰਡ ਹੁੰਦੀ ਆ। ਸੋ ਨੈਕਸਟ ਸਲਾਈਡ ਪਲੀਜ਼। ਓਕੇ, ਸੋ ਤੁਸੀਂ ਇਹ ਪਲਾਨ ਕਿਵੇਂ ਚੂਜ਼ ਕਰ ਸਕਦੇ ਹੋ, ਲਾਈਕ ਤੁਹਾਡੇ ਤੁਸੀਂ ਪਲਾਨ ਚੂਜ਼ ਕਰ ਸਕਦੇ ਹੋ ਤੁਹਾਡੀਆਂ ਨੀਡਸ ਕੀ ਹੈ ਜਾਂ ਤੁਹਾਡਾ ਬਜਟ ਕੀ ਹੈ। ਐਜ਼ ਆਈ ਐਕਸਪਲੇਨਡ, ਜਿਵੇਂ ਮੈਂ ਪਹਿਲਾਂ ਤੁਹਾਨੂੰ ਐਕਸਪਲੇਨ ਕੀਤਾ, ਲਾਈਕ 600, 900, 750 ਅਲੱਗ-ਅਲੱਗ ਪਲਾਨਸ ਨੇ। ਸੋ ਮੰਥਲੀ ਤੁਹਾਨੂੰ ਪ੍ਰੀਮੀਅਮ ਦੇਣਾ ਪੈਂਦਾ ਹੈ, ਅਤੇ ਕਵਰੇਜ ਦੇ ਉੱਤੇ ਡਿਪੈਂਡ ਕਰਦਾ ਪ੍ਰੀਮੀਅਮ ਤੁਹਾਡਾ ਕਿੰਨਾ ਹੋਏਗਾ। ਸੋ ਕਲੇਮਸ ਆ ਜਿਹੜੇ ਆਪਾਂ, ਜਿਵੇਂ ਹੁਣ ਤੁਸੀਂ ਡੈਂਟਿਸਟ ਕੋਲ ਜਾਂਦੇ ਹੋ, ਤੁਹਾਨੂੰ ਉੱਥੇ ਅੱਗੇ ਜਾ ਕੇ ਤੁਹਾਨੂੰ ਪੇ ਕਰਨ ਦੀ ਲੋੜ ਨਹੀਂ ਹੈਗੀ, ਡੈਂਟਿਸਟ ਆਪ ਉੱਧਰੋਂ, ਡੈਂਟਿਸਟ ਜਿਹੜਾ ਡੈਂਟਲ ਕਲੀਨਿਕ ਆ ਉਹ ਖੁਦ ਬਿਲ ਕਰਦਾ ਹੈ ਡਾਇਰੈਕਟਲੀ ਟੂ ਦਾ ਇੰਸ਼ੋਰੈਂਸ। ਸੋ ਇਹਦੇ ਨਾਲ ਤੁਸੀਂ ਲਾਈਕ OHIP ਜਿਹੜੇ ਆਪਣੇ ਹੈਲਥ ਕਾਰਡ ਹੁੰਦੇ ਆ, ਇਹਦੇ ਨਾਲ ਵੀ ਇਹ ਵਰਕ ਕਰਦੇ ਆ, ਅਤੇ ontario ਡਰੱਗ ਬੈਨੀਫਿਟ ਹੁੰਦੇ ਆ, ਉਹ ਵੀ ਇਹਦੇ ਵਿੱਚ ਮਿਲਦੇ ਆ।
Hello everyone. Okay, I'm going to talk about the Ontario Seniors Dental Care Plan. So this one is a provincial government funded plan. It is free dental services to seniors that are 65 years of age and older. There are a few eligibility requirements, and that has to do with income, whether it's personal or like an individual income or a household income between other people. And then you also don't hold any private other private insurance programs. So the eligibility, like I said, is based on income. So a single senior must have an income of less than $25,000 a year, and a couple have a combined annual income of less than $41,500 a year. You can apply online or your local public health unit. So the services that are included are regular dental hygiene services. So these would be your examinations and your assessments. So that's your preventative. So cleaning, just to make sure that there's no buildup there. They will also take x-rays for you to assess your bone health of your jaws. And if you have any broken teeth or cavities, they will fix those. There are some oral surgery services that are included that would be outside of a dental office, but they can make that referral for you. And same with root canals if you have an infection that goes beyond the top of your tooth into your bone. And then some periodontologist services, so that is into the deep tissue of your gums for a deeper cleaning, or if you have any diseases. Additionally, if you require anesthesia, so if you have to become numb in order to have any services, those are provided for you as well. That's all covered. Some things beyond prevention or cleaning that you might need, like prosthetics or dentures, will be partially covered. So if you find that you have pain and broken teeth that they can't keep, they will provide you information and you can get things like a denture at a cheaper cost. But you do have to go to your local public health unit to talk to them about that. Once you are in the program, it lasts for a year. So the end date for that one is July 31st. So you will have to reapply every year, and then you can continue to do that online or by mail. Once you have applied and you've been accepted, when you have to do the next year, it doesn't take as long. So you're already in the program, so it goes a little bit faster.
Okay. Hi again. So now I'll go over the second plan, or the third plan, sorry, which is CDCP. I'm sure some of us have heard about this plan already. So it is the Canadian Dental Care Plan, and what this basically is, it's a government-funded dental insurance program which helps cover the cost of oral health care services. So it is for Canadian residents who without dental benefits, and it is based on a annual net income, which we will go over. So to be eligible, you do need to be a Canadian citizen or a permanent resident. And it's for those who don't have dental insurance as well. You do need to have a filed tax return for the previous year. And then for the ages, it is covered for ages 65 years and older or under 18. And it is covered for those with special needs or disabilities as well. So now Angel will go over just the services that it covers.
So ये प्लान पिछले साल शुरू हो गया था for seniors and kids. Not sure how many have already applied for it. जैसे 65 and above के लिए और kids के लिए जैसे पिछले साल शुरू हुआ था, but there are some adults के लिए recently शुरू हुआ है. So under 70,000 जिनकी इनकम है, आई एम नॉट श्योर कि 65 अबव जैसे लाइक कुछ रिटायर्ड लोग हैं जिनकी इनकम RRSP से कनेक्टेड है, आई एम नॉट श्योर अबाउट दोज फाइनेंसेस, बट लाइक अंडर 70,000 100% कवरेज है और 80,000 से नीचे 60% एंड एक्चुअली 70 से 80 तक इज 60 एंड 80 to 89 जिसकी बेसिकली 90,000 से नीचे है उनकी 40% कवर्ड है. सो एप्लीकेशन प्रोसेस इसका यही है. एलिजिबल इंडिविजुअल्स जैसे जयप्रीत ने बोला कैनेडियन PR होनी चाहिए, आपकी एज एलिजिबल होनी चाहिए, आपने टैक्स भरे होने चाहिए. सो ये सारी चीज़ें फिर आप CDCP पे अप्लाई करते हो एंड इट इज़ कनेक्टेड टू योर CRA एज वेल. सो जब आप अप्लाई करते हो द लेटर विल इंक्लूड इंस्ट्रक्शंस. तो बेसिकली आपको इनविटेशन आता है CDCP की तरफ से और वो आपको बता सकते हैं कि वो आपने कैसे अप्लाई करना है. ऑनलाइन होता है ये सब. और व्हाट इट कवर्स, सेम प्रोसीजर जैसे हमने दूसरे प्लान्स के बारे में बात की. क्लीनिंग्स, पॉलिशिंग, फ्लोराइड ट्रीटमेंट, सीलेंट्स बेसिकली कैविटी प्रिवेंट करने के लिए होता है. एग्जामिनेशन और एक्सरेज भी कवर्ड होते हैं. इवन जो थोड़े से मेजर प्रोसीजर्स हैं जैसे रूट कनाल्स, एक्सट्रैक्शंस और डेंचर्स सब कवर्ड है. So let's go to the next slide. All right.
Hi everyone. So I get to talk about CADH, which is our school. That's where we are from. So the Canadian Academy of Dental Hygiene is committed to the development of innovative, quality, and progressive and theoretical practical education in the field of dental hygiene, dental health, and community sciences. So there's a huge focus on providing care to the community at our school. And it's a great option for a lot of people. We're dedicated to providing a challenging and supportive learning environment for our students to pursue the gain of knowledge and creative inquiry, critical thinking, and inclusive values and applied skills. And they're encouraged and cultivated here at CADH. So CADH is really dedicated to providing quality care to all of its clients and providing an excellent teaching environment for all of the students. So some things that are offered at CADH, teeth debridement, which is the cleaning. That's removing all the buildup within your mouth. We do oral cancer screenings, which are excellent. We've had clients that come in and some students find the start of oral cancer, so it would have gone unnoticed otherwise. So it's a phenomenal way to identify things before they occur. Periodontal and dental exams, those are checkups. We have dentists in the clinic to to diagnose and do checkups. We can also take x-rays. We can also provide nutritional and tobacco cessation counseling. So if your diet is maybe high in sugars or you find you have a high prevalence for cavities, we can actually make recommendations and help develop a nutritional counseling plan with you, as well as provide resources if you're struggling with quitting smoking. We do offer anesthesia, so desensitizing topical anesthetic, and also the dentist is able to apply local if it's necessary. And then we do as well provide fluoride and sealant treatment and whitening and sports guard services. Whitening trays and sports guards as well we can make. Zaid's going to carry on for me.
So guys, we known for a well care with a low cost dental care. Our care is $50, and that includes all your visits until you get your cleaning and you're done. With that being said, there is a friendly faculty, a friendly students who will be taking care of your teeth. And with that being said, you're gonna get a comprehensive dental care. With that being said, that's not only limited to having a cleaning, but also during all the assessments we do, we're gonna be taking care of everything. So whatever we see in your mouth regarding, like, God forbid, oral cancer or caries or any other issues and lesions in your mouth, we're gonna be able to detect that with the help of all the instructors and faculty within our college. I know it might take a bit longer time than regular cleaning and you're gonna go to your dentist, but with that being said, I'm not necessarily gonna find all those issues. If you're gonna come and I see you in 1 hour limit, you're gonna come in and out, I'm gonna be able to clean your teeth only that's in a regular dental office. But in coming to our school, basically instead of one person, there's going to be multiple instructors that they're going to come, check, make sure that everything is nice. We're going to be detecting and we're going to be doing all the necessary application that if you need a recommendation to be transferred to another doctor or surgeon or whatever, we're going to be doing all the necessary application for you. And with that being said, here's the price list for our services. So as I said, it's going to be $50 for cleaning, $10 to $30 for all the x-rays that you need. So it depends on how many x-rays. It depends on, we also provide panoramic x-rays. So you're going to be covered with whatever necessary x-rays that you need. We also provide sport guards. If you have kids that they play different sports, I'm not sure how much it's going to cost, but it's way more than that in regular offices. But in our school, we charge $40 for that. For the tooth whitening, I'm pretty sure that lots of you guys or your kids, whoever, are really interested in that. It costs $90 in our school compared to other clinics, probably $400 to $500. And also, if you need any copy of your file and your chart to transfer to any other dental office, we provide that as well for a cost of $30. So that's a wrap up for our presentation. Please, I believe Magm will take care. And we have the brochure for you, so make sure you have a copy of that. It gets all the details that you need for other clinics and especially our school as well. Thank you so much.
Yes, thank you, Zaid. Thanks for having us, you guys. We did bring, like I said, those brochures, so you're welcome to take one home. I hope that we have enough for everybody. In addition, we brought some client information packages. These are from our school. So basically everything that Zaid and Alejandro just went over will be included in here as well with a bit of additional information. So if you guys have any questions, we're happy to take them now. But thank you so much for listening and being patient with us.
I was hearing the murmuring from my colleagues who were saying it was a wonderful presentation, very good presentation. All the students who came, they gave their presentations. My first job in Delhi was in the Irwin Hospital as a purchase officer. Maulana Azad Medical College is associated with the Irwin Hospital, and whenever the professors, surgeons, they used to go to the patients, the research scholars also, the students also, they were accompanying the doctor, and he was telling each and everyone, this is what we have to do, this is what we have to do, this is what we have to do. The same thing I heard today, that if you come to our institute, it is not only we people, we are the learners or teachers. They will be searching and they will be treating you, and under their guidance we will be learning. This is how the students, they learn practically. We are very happy. Kindly give us the pamphlets. I will circulate it to the group as well as, and you can give to each and every one.
I actually want to add one more thing.
Yes.
So, the moment that we're here, it's been 2 years of dedication, serving the community, but we couldn't do it, as you said, without the help of everyone else. That includes all those people. They are not from Toronto, from Vancouver, and we couldn't make it to this point without the help of the community members. That include our friends, family, people that we don't know, but they came for us in order to help us, but at the same time they are getting a wonderful treatment because of the hard work that we do, and all the faculty that they come and check step to step. So I know that you might be saying that, oh, that's going to be taking lots of time, but we all have extra time that we're going to be spending it on our phone or whatever, but you can come to our school and get a beneficial cleaning.
The seniors are also free throughout the day, and they want something for amusement. They will be coming, talking to you, because there is a generation gap, and we want to learn many things from you. And really, I offer to your teacher that you should come on Friday, because today we have only this much members, and on Fridays this partition is removed and we have these 2 rooms, and it's a big room. We have about 400 members of our club, so thank you very much, because this time they told that they will be coming on only on Wednesday, because on Fridays you don't have the classes, and that's why they declined the offer for Friday, but there could have been more. So I think when we will get your pamphlet, all this will be circulated to the whole group, and they will come to know about your services. And once again I shall say, give a good applause to these students. Throughout, their presentations were wonderful, and I think how much assessment we should give? Excellent.
To us also.
Yes.
Good
Pardon?
listeners.
Pardon?
Good listeners.
Yes.
Good listeners. That was very important. And today I was very much impressed, because there was not even a slightest voice आवाज़ निकल गया मुंह से, तो ध्यान करिएगा. और बच्चों ने भी 2-3 बच्चों ने हिंदी में, पंजाबी में कहा. बहुत अच्छा लगा जब ये हमारी भाषा में बोलते हैं, बहुत अच्छा. और आज की प्रेजेंटेशन आई कैन से, बिकॉज आई ऑलवेज ऑपरेट कैमरा, it was one of the best presentations. And listeners, once again, give a applause for you. Thank you. Thank you. Now you will have certificate.
Okay, so मैं थोड़ा जा add on करना सी, एक चीज़ मिस हो गई है. जे किस mostly I know तुसी सारे ने apply करता होना CDCP. अगर नहीं किया तो just canada.ca जड़ी website है उत्थे जाओगे. It's very easy, बहुत सौखा है. तुसी canada.ca ते जाके क्लिक करोगे, उत्थे ऑप्शन आएगा तुहाडे कोल apply online. ਤੁਸੀਂ ਅਪਲਾਈ ਆਨਲਾਈਨ ਕਰਕੇ ਤੁਹਾਡੀਆਂ ਡੀਟੇਲਸ ਮੰਗਣਗੇ ਲਾਈਕ ਸਿਨ ਨੰਬਰ, ਤੁਹਾਡਾ ਐਡਰੈਸ, ਨੇਮ, ਲਾਸਟ ਨੇਮ। ਇਟਸ ਵੈਰੀ ਸਿੰਪਲ। ਉੱਥੇ ਜਾ ਕੇ ਤੁਸੀਂ ਸਬਮਿਟ, ਦੈਨ ਯੂ ਸਬਮਿਟ, ਫਿਰ ਤੁਹਾਡਾ ਲਾਈਕ ਵੀਕ ਵਿਦਨ 15 ਡੇਜ਼ ਤੁਹਾਡਾ ਕਾਰਡ ਘਰ ਆ ਸਕਦਾ ਹੈ। ਸੋ ਮੈਂ ਥੋੜੀ ਇਨਫੋਰਮੇਸ਼ਨ ਦੇਣਾ ਚਾਹੁੰਦੀ ਸੀ ਇਨ ਕੇਸ ਕਿਸੇ ਨੇ ਨਹੀਂ ਅਪਲਾਈ ਕੀਤਾ, ਤਾਂ ਕਿ ਸਾਰਿਆਂ ਨੂੰ ਬੈਨੀਫਿਟਸ ਮਿਲ ਸਕੇ।
ਇਸ ਤਰ੍ਹਾਂ ਹੈਗਾ, ਲੈਟਰ ਸਾਰਿਆਂ ਕੋਲ ਆ ਗਈਆਂ ਨੇ, ਮੇਰੇ ਕੋਲ ਵੀ ਆਈ ਸੀ। ਔਰ
Yes, I'll have to cheers.